Meet Charlie McAvoy, a 20-year-old star defenseman for the Boston Bruins. After experiencing heart palpitations during an NHL game against the Edmonton Oilers, Charlie underwent an ablation procedure and is now successfully managing his supraventricular tachycardia diagnosis, all while logging 22 minutes of ice time per game. But Charlie is not the only high-profile athlete to experience a cardiac complication. Rich Peverly, Craig Cunningham, and Jay Bouwmeester have all suffered cardiac episodes resulting in the termination of their careers and further complications such as amputation. Despite their level of physical fitness, athletes are 30% more likely to develop arrhythmias compared to their non-athletic counterparts. As a result, Charlie now wishes to educate elite athletes everywhere about supraventricular tachycardia and encourage others to be proactive with their health. With the Bruins down 3-2 with just 58 seconds to go against the lowly Oilers, Charlie tried to take control of the game and overexerted himself. Charlie experienced a lack of coordination between his heart's electrical signals, which triggered a sustained abnormal heart rate between 150 and 250 beats per minute. In addition to a rapid heart rate, he had shortness of breath, dizziness, excessive sweating, and fainting spells. Upon consulting the team doctor, Charlie underwent a routine ECG, and the findings suggested that he had AVNRT, which is a type of supraventricular tachycardia. SVT is a type of abnormal heart rhythm that occurs in 2 of every 1,000 people. Traditional triggers of SVT include caffeine, alcohol, smoking, and physical or emotional stress. Charlie's symptoms are typical of an SVT patient, but some patients also experience shock, hypotension, anxiety, exercise intolerance, and signs of heart failure. If so, a defibrillator may be necessary to resynchronize the heart, or if the patient is stable, lower impact vagal treatments may be indicated. If these treatments fail, the drug of choice for SVT is adenosine. These treatments are effective short-term, but Charlie opted for a more permanent solution. It's a procedure with an up to 97% success rate and only a 5% reoccurrence rate. But what is catheter ablation? Essentially, it's the purposeful destruction of electrical regions in the heart that are malfunctioning. A catheter equipped with electrodes for tissue destruction is guided using fluoroscopy and fed into the heart via a major vein like the femoral or jugular. The problematic tissue in the heart is then destroyed using a radiofrequency current. Catheter ablation is safe, effective, and is now considered an excellent first-line approach for treatment of SVT. For Charlie, this procedure virtually eliminated the possibility of his SVT returning and ensured that he returned to playing for his beloved Bruins within just a few weeks. With increased awareness and proper screening for SVT, cardiac complications at sporting events can be reduced. To learn more about SVT, visit the Mayo Clinic website, the Heart and Stroke Foundation, or the Mended Heart Support Group.